Hi, and welcome back to the channel. On this channel, we talk about everything medicine, nursing, and university related. Now, children. Now, children. Sorry, I'm eating, I'm hungry. All sorts of things are happening today. This mug, it's made from a plant. So, this is like the fruit of a plant. And I've never seen the plant myself. I just know this. So it's called a calabash plant, and it's a calabash cup. It's used by the Rastafarian people in Jamaica. All Jamaicans know this, unless you're born abroad. Maybe you don't. But it keeps hot things hot and cold things cold. So if you put something piping hot in here, it will stay hot for a long time. If you put something really cold, it will stay cold for a long time. So I'm actually drinking my coffee from it. So I bought that in Jamaica. Not now. I bought it quite some time ago. Yeah, so that's a calabash. But that's not what we're talking about today. Today we are talking about this book, Differential Diagnosis. And I'm talking about this book today because I'm doing some updates. As you all know, I'm a advanced nurse practitioner, and I'm doing some updates. And one of the things I'm doing updates on is my ability to do differential diagnosis. For those who don't know what that is, it's when a patient is presents to you and they have a group of symptoms. And from that group of symptoms, you make a diagnosis. But you might think this person has got, let's say the person's got diarrhea, fever, vomiting, and you might say they've got gastrointestinal disturbances, right? However, there can be other diagnoses as well. So it can be other things. So it could be that they've been poisoned, It could be that they have an ulcer. It could be that they just ate something that they shouldn't eat and all of that. It could be that they got IBS, It could be Crohn's disease. It could be anything. So that's what a differential diagnosis is that you're thinking is this one thing, but it could also be other things. So based on the other things, then you might do a blood test. You might send off for a stool sample, depending on what it is, of course. And you might also do a saliva sample, whatever. So let me give you an example. So this book, by the way, it's got 3 authors, 2 Andrews and an Eric. And it gives you the diseases. It tells you how to use the book, first and foremost. Oh, gosh, I can't pick up where this camera is. It tells you how to use the book. And it tells you, so green mean a common cause or symptom or sign. Orange means might occasionally happen, and red mean will happen rarely. So let me find, it's a condition. Let's say a cough. Cough is a really good one because we're coming into winter and everybody will be coughing. So a cough is a reflex, explosive expiration and prevents aspiration and promotes the removal of secretions and foreign bodies. So you take a history, right? Based on your history, you're thinking if this person is coughing over 8 weeks, you're thinking cancer. Might not be, but it could be. Is this person a smoker? Could it be COPD? Does this person have allergies? Could it be asthma? Does this person have a cold? Could just be a cold. Is this person coughing for like 4 weeks and they had a cold 2 weeks ago? So maybe the airways are still irritated and that makes them cough for a longer time. Could this be that they've got acid reflux? So many differentials that one cough could be. And this is why you take a history from your patients. I usually say to my patients, don't lead me, allow me to ask you the questions. Don't tell me that you've got, I'm calling because I've got a chest infection when you're coughing for 2 days. Allow me to ask you the questions. So this book is quite good. It tells you they're green, acute. They might have inhaled a foreign body, mainly for children, by the way. It could be a respiratory tract infection, so upper respiratory tract or lower respiratory tract infection. And then the orange is talking about TB, bronchiectasis, pulmonary edema. If they're coughing up pink frothy things, you think pulmonary edema. TB, if they're coughing for a very long time and they have blood, when they cough, hemoptysis, so they've got blood, coughing up blood. Lung cancer, blood stained as well, by the way. and pulmonary embolism, also blood stains. So you see, one thing can be a plethora of different diagnoses. So this is why your doctor or your nurse practitioner will send you off to do testing, because they're not sure. Some things you're really, really sure. If somebody's coughing for 2 days and they put, oh, I'm coughing for 2 days, and patients do call you up to say they're coughing for 2 days, and you're thinking, have you got a cold? Yes, I'm coughing up yellow stuff. Okay, so that's not an emergency, but patients do think it is an emergency if they're coughing up yellow stuff. Yellow stuff is probably just saying you've got a cold. So we talk about sputum. What it looks like, sputum is what comes out, what it looks like. So first and foremost, we're thinking onset. When did it start? Duration, how long have you had it? Sputum, the thing that you cough up. What does it look like? Is it green? Is it red? Is it pink? Is it yellow? Is it clear? Is it white and frothy? And then you think smoking history. Are you a smoker, past smoker? You've never smoked. And then you talk about the associated symptoms. So it might be that the person is wheezing. So you're thinking asthma immediately. They've got shortness of breath. You're thinking asthma or COPD. So this is a differential. So that's what this book is about. You're thinking if they've got pleuritic chest pain, that they could have pneumonia, or they could have an embolism. And then you think about all your examinations that you will do. So you take a temperature. So if they're coughing and they've got a fever, is it a cold? Is it 2 days or is it 2 weeks? So is it a cold or is it pneumonia? Is it bronchitis? You do inspection of the chest, palpation of the chest, and then you do an auscultation to make sure. And these will give you an idea. Inspection, palpation will kind of tell you if it's COPD and stuff like that. Palpation, inspection will tell you if one side of the lung is higher than the other, will tell you if one side of the lung is rising while the other side isn't. And then auscultation, you're thinking about things like pulmonary edema when you do your auscultations. Then from this now, you will do your investigations. So based on what's happened, say the person says, I've got blood in my sputum, then you do a sputum culture. If you're thinking asthma or COPD, you might do a peak flow. More asthma for the peak flow than COPD. And if they've got things like blood, you're doing a white cell blood count. You do a full blood count. That will cover everything. And then if they're coughing for more than 8 weeks, you're thinking chest x-ray, because could they have something like lung cancer? Could there be something in the lung? Could it be pneumonia? Could it also be that they've inspirated something, that sort of stuff. And you can do a respiratory function, especially if they're COPD patients. You can do a spiral test. But really, I wouldn't suggest doing a spiral test on anyone who's COPD, who's really, really coughing, because the chest just isn't strong enough at that time to do a spiral test. And depending on what you find, you can send them back for a CT of the thoracic cavity. You can send them for something like angioedema, pulmonary, to check what's going on. You can send them for a scan, and you can do pH studies as well. And of course, your red flags, the book also talks about red flags, is if they've lost weight, if they're having night sweats, and they've got hoarseness of voice like that, and that might be thinking, oh, they're a smoker. You're thinking this might be cancer, So that's what this book is about, and I'm doing an update just to rehash my thinking. And remember, I've done a video, I don't know if I'll post it before or after this one. I've done a video on the nurse that was struck off, and we really need to keep up to date with all our nursing stuff. Whichever type of nurse you are, depending on what type of nurse you are, as a nurse practitioner, then I need to be up to date with my differential diagnosis. So thanks for watching. And don't forget to like, share, and subscribe. And don't forget that when you like, share, and subscribe, it will flag my videos up to the algorithm. So thank you for watching, and have a great day.